I'm going to talk about ankle versus subtalar joint instability, because the ankle and the subtalar joint, people come in with, quote, ankle pain. So we're going to talk about that. The typical ankle joint is more complex than you think, because you have medial and lateral ligamentous structures, which we'll go through. You have inversion and eversion problems with the foot. You have plantar flexion and dorsiflexion problems, and sometimes you have a combination of an injury. We'll talk about it all. Interestingly enough, you'll see somebody come in with this foot looking like this after an ankle sprain, and it's very painful. They're limping. They can move the joint, but the lateral, you know that the lateral ligaments are shot at this point. You have a lot of swelling, and this doesn't look like a lot of swelling, but if it's a young person who has virtually bony ankles, this is extreme. Sometimes you'll see somebody walk in like this. I don't know, my foot doesn't hurt, but I have this big bump on the side. So this is a Charcot joint with ankle joint instability. This is actually the talus slipping out of the ankle mortise medially. Eventually, this gentleman had the bone actually rupture right through in the skin, even though we immobilized him and we didn't fixate him. He can't feel, so he didn't know. Kinesio tape. I've used a lot. I'm telling you that I have evolutionized my practice with this silly tape. I have techniques for the Achilles tendonitis and tendinosis, but for ankle sprains, especially the young athlete, instead of putting him in big braces, we use the K-tape. And it's actually based on the body's own natural healing process. It exhibits its efficiency through activation of the neurologic and circulatory system. It has an incredible lymphatic drain, which reduces swelling and causes increased stability of the muscles. And it's constantly working as you have it on. I don't know if anyone's ever used it. As an aside, I use it on my hammer toe surgery to reduce edema, because it helps lymphatic drainage. So I'll use it on bunions and hammer toes and plantar fasciitis and tendinitises, and I'm getting very good relief. I give that patient their own box of tape. They go home, they learn their own techniques, and their recovery is quick.